Start.
Yeah, 1 second, ma'am. Are you able to see my screen?
Yes. Yes.
Okay. Right.
Please stop
So
presentation.
yeah, I did that control. So good evening, everyone. Welcome to our webinar. So it is brought by Sudisha Counseling Center, which has been guided by Dr. Geetha Challa, ma'am. So as you are aware from past, this is the third day. From 2 days, there are a couple of sessions which have been done. So here the main objective of our counseling center is nurturing mental health and creating awareness. So these webinars are aimed at shedding light on the challenges of individuals and facing in today's society and offering guidance, support, and solutions. So moving on. So let's have a quick recap what has been done. Okay. So in our previous webinars, we touched upon emotional wellness as well as the tools to manage the stress. So today we are here to create awareness, break the silence, and understand the conditions like um, postpartum depression and premenstrual dysphoric disorder. So this will affects lives and what can we can do about it and what how we can help you in this regard. Those things we are going to talk in this webinar. So we will take you further by focusing on mental health challenges specifically faced by women. Um, so moving on. So let me give a quick briefing about the our counseling center and how different it is. Okay, so here Sudisha Counseling Center, it's a unit of Manojagrithi, a registered NGO working since 2012 to promote mental health awareness. Our team includes psychologists, counselors, and mental health professionals, which have been, those are all the people who are being guided by Dr. Geetha Challa, ma'am, and supported by senior advisors and technical experts. So, our mission is very simple. It is nothing but awareness, guidance, and support. And no need a special introduction about the person whom you can see here, a visionary behind Sudisha. So, here, ma'am, under the ma'am's guidance, this is something no where as a psychologist, her guidance at every step has made us to stand out here, giving out the sessions on most important core elements which will definitely pass on a positive element to the society. So the visionary and the here with her guidance, let me talk about a little about Vijay Lakshmi ma'am. So here her guidance at every step has made us to come through this level in how each for every problem there is a solution. This is being told by her. So that's how she has guided us our path, and special thanks to her. So we have couple of webinars, upcoming webinars and the past webinars which are being done. So today we are at the day 3 webinar, which is all about the postpartum depression and premenstrual disorder. So let me first take you through the conscious breathing. Hope everybody is ready for that. So yes. Yeah. So I wanted everybody to sit in a comfortable position. Let's begin by sitting in a comfortable position, shoulders soft and relaxed. Once you are good to go, gently close your eyes. Now, bring your attention to your breath. Just notice how you are breathing, the natural rhythm without changing anything yet. Feel the cool air as it enters into your nose and the warm air as it leaves. When you are ready, take a slow breath in through your nose, counting softly in your mind. 1, 2, 3, 4. Pause gently at the top for a count of 1, 2. Now exhale slowly through your mouth or nose, counting 1, 2, 3, 4, 5, 6. Again, breathing in deeply, feeling your belly and chest expand. 1, 2, 3, 4. Pause softly. 1, 2. And breathe out slowly, letting go of any tension which is bothering you. 1, 2, 3, 4, 5, 6. With each breath, notice the sensations, the rise and the fall of your chest, the feeling of air moving in and out. If your mind wanders, that's okay. Gently guide your focus back to the breath. Let's repeat the rhythm together for 3 more breaths. Take a slow breath in through your nose, counting softly in your mind. 1, 2, 3, 4. Pause gently at the top. 1, 2. Now exhale slowly, letting go of any tension. 1, 2, 3, 4, 5, 6. Take a slow breath in through your nose, counting softly in your mind. 1, 2, 3, 4. Pause gently at the top. 1, 2. Now exhale slowly through your mouth or nose, counting 1, 2, 3, 4, 5, 6. Again, breathing in deeply, feeling your belly and chest expand. 1, 2, 3, 4. Pause softly. 1, 2. And breathe out slowly, letting go of any tension or stress. 1, 2, 3, 4, 5, 6. Now take one final slow inhale, pause, and exhale completely. Rub your palms, place them on your eyes gently. When you are ready, open your eyes. Take a moment, notice how you feel. Calm, grounded, and present. Now, let's get into the deep breathing. Let's begin by sitting comfortably, shoulders relaxed. Once you are comfortable, gently close your eyes. Take a slow, deep breathe in through your nose. 1, 2, 3, 4. Hold the breath gently. 1, 2. Now slowly breathe out through your mouth. 1, 2, 3, 4, 5, 6. Again, breathe in deeply, feeling your belly rise. 1, 2, 3, 4. Hold for a moment. 1, 2. And exhale slowly, letting go of tension with each breath. 1, 2, 3, 4, 5, 6. Continue this gentle rhythm. In for 4, hold for 2, out for 6. With every exhale, imagine stress leaving your body like a soft wave. Let's do 2 more breaths together. Breathe in deeply. Feeling your belly rise. 1, 2, 3, 4. Hold for a moment. 1, 2. On exhale, slowly letting go of tension with each breath. 1, 2, 3, 4, 5, 6. Breathe in deeply, feeling your belly rise. 1, 2, 3, 4. Hold for a moment. 1, 2. And exhale slowly, letting go of tension with each breath. 1, 2, 3, 4, 5, 6. Breathe in deeply, feeling your belly rise. 1, 2, 3, 4. Hold for a moment. 1, 2. And exhale slowly, letting go of tension with each breath. 1, 2, 3, 4, 5, 6. Now take one final deep breath. Hold and slowly exhale. Rub your palms slowly. Place them on your eyes. When you feel comfortable, gently open your eyes. Bringing your attention back to the room, noticing how calm and grounded you feel. So here I have my teammate Navya, who will be taking you through the grounding technique. Navya, please carry on.
Yeah, thank you so much, Preeti. We felt very calm and composed. Hello, everybody. Good evening to all the participants. And it is wonderful to see that you have brought calmness and stillness to your breath with the conscious and deep breathing techniques. Now, let us bring that calmness and focus to our present moment, fully here and fully ready. Let us use our five senses to anchor us even more deeply, to truly root ourselves in this moment and prepare for our upcoming discussion. We are going to engage our other senses. This is a simple grounding technique, but a powerful technique to bring your focus and uh, to to the present moment. Okay, let us start with the grounding technique. Let us focus on the five things you can hear. So, yeah, gently close your eyes and without trying too hard, just gently open your awareness to the sounds around you. Listen, can you pick any five different sounds around you? Perhaps it could be the gentle whir of the fan, or the birds chirping outside, or even the subtle sound of your own breathing. Just acknowledge these 5 different sounds as they come to you. Now, let us move on to 4 things you can feel. Let us turn our attention to touch. Notice 4 things you can feel right now. Perhaps it can be the chair beneath you, or the texture of your clothes, or the feet on your floor. Just bring your awareness to 4 different physical sensations. Yes, now moving on to 3 things you can see. Without moving your head too much, simply let your eyes gently land on 3 different objects in your immediate environment. Notice their color, their shape, maybe the details of the object. Just 3 distinct things you can clearly see. Now, let us move on to 2 things that you can smell. I'm shifting our senses to the smell. Take a gentle inhale. Can you notice any 2 different smells around you? Just bring the awareness to 2 different sense of smell. It could be just the gentle aroma of the air around you. Just 2 distinct smells. Now, finally, let us bring our awareness to the taste. One thing that you can taste. I hope you all have carried a tamarind with you. Take a small piece now and focus fully on that taste of the tamarind. The tamarind, its unique tangy taste of the tamarind, its sweetness and the texture. Let it fully occupy your attention for a moment. If you don't have the tamarind, you can simply recall the taste of the tamarind in your mind and focus fully on that one taste. I hope you all had the great tasting experience with the tamarind. Yes, so take one last deep breath in and slowly release it. Feel yourself more fully into this present moment and in this space. Yeah, dear participants, thank you so much for taking time to ground yourselves. So, you all are here present, and we are ready to begin our discussion on postpartum depression, and premenstrual dysphoric disorder. So, they are simply known as PPD and PMDD. So, now my teammate Preeti will take you through the discussion of postpartum depression. Yeah, Preeti, can you please take over?
Yeah. Thank you, Navya.
Yeah.
Hope you can hear me.
Yes, I can hear. We all can
Yes.
hear.
So here comes the beautiful picture where everyone can see. Yes. So is there something I have to specifically mention when I show this picture, Navya?
Yeah, see,
Yes.
as just seeing by the picture, we feel so connected emotionally.
Yes. Correct. So motherhood is it is not just a role. It is something called as a transformational journey. It it brings love, growth, challenges, and strength. Today, we'll also talk about how to embrace this phase with support, understanding, and self kindness. So, moving on, I just wanted our participant also to actively participate so that we can we can have an interactive session over here. So, chat box is very much open. Here, what comes into your mind as soon as you see this picture? I just need answers in the chat box. What comes into your mind as soon as you see this picture? I wanted answers. Confusion, multitask, new mother confusion. Okay. Mother care and love, safety, new mother and an infant. Okay. Anxiety, wow, unconditional love. Yes. Thank you so much for your participation. Yes. So here there are multiple things which are going through, right? So take a moment to reflect or share. So the emotional connect, before diving into the topic, I wanted to get into that emotional connect. So here comes my next slide. Okay. So you can see my next slide, Navya. I just need an answer from someone so that it will be helpful.
Yeah, we can
Yes.
see.
Yes. So here are some post pregnancy depression symptoms and signs. which are very clearly seen, right? These are nothing but there are combination of symptoms here. Those are mood swings, persistent depressive, social isolation, appetite changes, loss of enthusiasm, and anxiety. These are only couple of things which I am mentioning here. More than this, it depends upon the individual mother, what they have been gone through or what they are going through. So these are the main causes of postpartum depression, which may be because of the previous history of depression, or there are a lot of hormonal changes which happens, and there is a lot of stress, and there is a lack of sleep because of taking care of the little one, and family history of depression also could be few of the causes of this postpartum depression. So when you talk about depression, so don't think that it is not curable. Everything, anything and everything has a solution, but until and unless it is expressed, and it depends upon the severity.
Preeti, sorry to interrupt. Can you make the slide in full presentation?
Yes, I can. Is it clear?
Yes.
Okay. So the depressions um is generally this happens with every mom, okay, but there are symptoms which are seen for only couple of days. The name is it is named as baby blues, and if this symptoms may last for a couple of months, weeks, and for a longer period, then that actually is called as a postpartum depression. So the baby blues are nothing but it begins within a few days of delivery, and it will be there for 2 weeks. But whereas if the mom is going through the symptoms for a longer period of time, it could be for more than 2 weeks or for months, then it is called as a postpartum depression. So now I would like to clearly specify you how would with the normal mood changes versus the postpartum depression. So there is a particular things which we have to examine here to understand where it is actually called as a depression or it is just a baby blues. So the duration, as I mentioned you in my previous slide, it is if it is a baby blues, it will only last for few days. But if it is more than 2 weeks, if it lasts for months, then definitely it is considered as a depression. The baby blues will be only for it will be mild and manageable mood swings. Whereas if there is something different, if they are going through, then you can see mother going through a severe sadness, irritability, and hopelessness. And it also impacts on their daily life, which if it is a normal mood changes, they can easily manage the daily tasks. But if it is a depression, they will be unable to function and work, relationships, self-care. So they will be unable to focus on those elements. For baby blues, no diagnosis needed. For whereas for postpartum depression here, DSM-5 criteria is very much required. It should meet to that. But here I will also would like to specify here in my next slide how it is being treated. Okay, and the treatment needed here is for baby blues. Uh, can we unmute that participant where we are getting the noise? It's unmuted. Please mute him. Okay. So treatment needed. Usually for baby blues, there is no treatment required because it is self-resolves. But for the depression, if it is lasts for a week, more than months, then yes, therapy is required and counseling medication is required. So I was talking about the DSM-5 criteria. Here, a major depressive episode, here it follows the certain symptoms. Okay, depressive mood, okay, and then lack of interest and loss of weight, change in the appetite. Okay, so these are all the loss of energy, feeling of self, a feeling that no, I'm worthless. Okay, and then lack of concentration. So these are all the criteria where we can identify this particular depression. And I would like to tell you one thing here. As per ICD, this postpartum depression cannot be treated as a separate element here. It is a part of a uh, it is a part of a mood disorder. It comes under the mood disorder only. So if it based on the severity, it will be coded at the different levels. Okay, so it is nothing but if it is severe mental and behavior disorder, where the period of about 6 weeks after childbirth, during which the mother reproductive organs return to their original non-pregnant condition. So here it is highly severe. Then it is treated as F53.1. And whereas if it is mild and moderate, then it is being coded with F32.x. So the key symptoms would be persistent low mood, loss of interest, guilt, and sometimes no psychosis. Okay, there will be a couple of delusions and hallucinations in severe cases. So this diagnosis will depend upon the weeks. Less than 2 weeks, then okay, it is baby blues. If it is more than that, then it should be considered as a depression. An expert suggestion is very much required. So here I would like to specify you one case study where we have identified and given the treatment based on it. So the first time mother, 0 week old baby boy, okay, so these are the stages where the mother have gone through. Okay, planned pregnancy, supportive family, feels overwhelmed, blames, self-blaming, disconnection from the baby. Okay, and socially getting disconnected, loss of appetite, sleep issues, feels family would be off without her. So here the client we have identified. I just wanted to make it as a confidential information about the client. So she was just 32, a first time mother, 6 week old baby boy. So it was very much planned pregnancy, strong marriage, supportive family, no prior history of depression. The symptoms what we have observed is feels overwhelmed and cries for no reason and believes that she's terrible mother and feels disconnected from her baby. So because of that, she lost her appetite and can't sleep even when the baby is sleeping. Avoids all the social connections and then secretly thinks her family would be better off without her. So these are the thoughts which were running in her mind during this depression phase. So we have done a mental status examination for this particular client to understand. So we have run through the appearance and behavior. When we have seen there was a lot of tiredness and poor eye contact, okay, and slowed movements, speech soft, slow. It was just a monotone. Mood was hopelessness, okay, and then sad, and affect was constricted and tearful. Thought process was logical but ruminative, focused on themes of inadequacy as a mother, always self blaming, and express guilt and worthlessness. Uh, Sometimes, no, it has been also told about the suicidal ideation and cognition, reports difficulty in concentration and making decisions. These were the MC MSc examination of the client, which we have done, which we understood after the interaction with the client. And the treatment and therapy for the particular this client, okay, or for any other client who is going through PPD, it's cognitive behavior therapy, which will definitely helps to identify and change negative thought patterns and behaviors. And interpersonal therapy, this also will help on improving relationship and resolving the interpersonal conflicts. Medication, yes, it is required if the depression is extreme, generally considered safe during breastfeeding, but must be prescribed by a doctor or psychiatrist. So practical help from the family, friends will work very well. So nutrition, sleep, and gentle exercise, these are the self-care which we advise them. So for PPD, how it can be assessed and scales as per the clinical assessment. There are gold standard for screening and the score level, if it is greater than 10, then possible depression. If it is a patient health questionnaire, if the depression screener also effective in the postpartum period, which cannot be diagnosed, is it's a slowly or relying on someone's opinion or online quizzes, and based on their condition, if they google a lot on this, that cannot be relied. A single conversation without a structured clinical interview also will not work. It is a pattern where they have to come back, so it cannot be resolved in one sitting. And as per the WHO and global studies, likely 13% of postpartum women globally face this kind of depression. And studies also proved that 17% of new mothers are experiencing this postpartum depression. So, as per the clinical settings, among seven mothers, one woman are likely to be affected with this postpartum depression. So, clear understanding here is everything for everything there is a proper diagnosis which should be taken care. So, healing begins the moment you realize you're not alone. So, always seek for help when the depression is severe. Don't think that it can be resolved at home. Yes, as I mentioned you in my beginning of the session, that it is a baby blues, it will only last for 2 weeks or maximum 3 weeks. But if the condition increases for more than 3 weeks, okay, or months, then definitely you need a help. And think that always you're not alone. So happy mother, always the happy child. Early help will brighten your days, and please consult the expert. So here I invite Navya to take over from here.
Yeah, thank you, Preeti, for those incredibly it's important insights which everyone needs to be aware, and shedding the light on postpartum depression. Now, dear participants, we are going to shift our focus to another significant, yet it is often misunderstood, hormonal mood disorder. It is called as a premenstrual dysphoric disorder, or PMDD. Yeah. Uh, to start with, I want to share a story uh, with this. By seeing this picture, I want to share a story with you all that might sound familiar to most of you, or you could relate this to someone who you care about. So in this picture, can you see a woman standing over here? Let me tell a story about her. Imagine her name is Maya. Okay. Every month for about 2 weeks before her period, it's like the switch flips. The vibrant, joyful person, she transforms into a different person altogether. And her partner knows and who loves her very much understands this transformation, and he also get confused why she is really behaving like that. And she becomes consumed by an intense sadness, burst, anger, or whatnot. Feel she feels like it's impossible to be like herself and to control herself. You know, and to say this, it's just not a bad mood. It's like every month she's going through this. It's a monthly disruption. You know, Preeti, can you add any reflection on this story?
Yeah, their story is very clear with one slide, Navya. I can see the phases of moon. So
Hmm.
that clearly says that the phases of the women over there, okay, in a single month. So
Yeah,
that's how I can see. And the depressed man behind her. And also, it is very clearly seen the two sides of a woman.
absolutely. Yeah.
Okay, yeah.
Yeah, and through this picture and the story which I have shared, maybe the participants, you could also have understood that it is not only affecting the woman, it is also affecting the, her partner, maybe her family, her relationships, everything. So it's impacting on, everything. So, but today, in our discussion, we are here to change that. We are here to validate these experiences, to bring clarity, and you know, to explore what can be done and how to move towards understanding, support, and empowerment. So let me discuss in detail about this disorder, premenstrual dysphoric disorder. Can you move on to next slide? So it's a brief definition of premenstrual dysphoric disorder. It is like a severe form of premenstrual syndrome, PMS. It is often called as PMS, which every woman undergoes these symptoms. Okay, and this syndrome, this PMDD, it causes intense emotional and physical symptoms in the luteal phase. I mean to say, just 2 weeks before her menstruation starts, she undergoes these kind of symptoms, and it significantly affects, interferes with her daily life and relationships. So here is the you know different three phases of a woman's menstrual cycle. You can see in this picture. It is a follicular phase, ovulation, and the luteal phase. Here, just after the woman got her period, from that phase to about 2 weeks, it is called as follicular phase. And after that, she undergoes ovulation, where the egg releases from the ovaries, and from then it is called as luteal phase. And in these three phases there are number of hormonal fluctuations you can see, and the key hormones would be like progesterone and estrogen. Okay, and to tell about these symptoms, every woman undergoes these symptoms. It is called as PMS, premenstrual syndrome. It is common and it affects 90% of the women who menstruate. But coming to the disorder which we are discussing now, the premenstrual dysphoric disorder, it is actually very rare and severely affects the mood and everyday life of the woman. Whereas PMS symptoms are manageable, but PMDD symptoms cause significant effect in the woman's life. Next. So we will go through the DSM-5 criteria for PMDD. DSM-5 is nothing but Diagnostic and Statistical Manual. It is published by American Psychiatric Association, where we can have all the disorders over here. For the clinical diagnosis, we use the DSM-5 criteria. So for PMDD, there are three number of criteria we consider for women to diagnose whether she is experiencing PMDD or not. So in this, the criteria A is like in the majority of the menstrual cycles of the woman, at least 5 symptoms must be present in the final week before her menstruation. So those 5 symptoms include the combination from criteria B plus criteria C. When there should be at least one criteria present in criteria B. Those are marked, mood swings, remarkable mood swings that she can observe. Or number 2 is marked irritability and anger. And the number 3rd one is like depressed mood, which really affects her daily life, and hopelessness and self depreciating thoughts, and marked anxiety, tension, and feelings of being on edge. So out of these 4, at least one should be present from criteria B. And moving to criteria C, out of these 7 symptoms, at least one must be present. So you can see all those 7 symptoms, and there are other criteria also to clinically diagnose PMDD. That includes, it causes real life problems. That symptoms which the woman undergoes, it should significantly disrupt her everyday work, school, or any relationships. And the next criteria is, it should not be diagnosed as another disorder. So according to the symptoms, we may think that she might be having other disorders, but it should not be coming under other disorders. So next criteria is, it is definitely confirmed by tracking only, because menstrual cycles should be tracked regularly to diagnose whether she is really undergoing these symptoms and having those patterns or not. So tracking here is the important consideration we do for diagnosis of PMDD. And next criteria is, it should be ruled out of other causes. And I mean, the women may be taking any other medications or substances. So the symptoms must not be caused by other medication use or substance use or any other medical illnesses also. So even the thyroid disorder symptoms will also look like the same symptoms of this PMDD, but we have to rule out all these to confirm premenstrual dysphoric disorder. So this is the criteria from Diagnostic and Statistical Manual 5. So the general causes of PMDD would be like, as we already discussed, the hormonal fluctuations may cause PMDD, or genetical influence also plays the role. or the history of mood disorder, if the woman is already having any other history of mood disorders also, maybe it can cause PMDD, or chronic stress also cause and increased inflammatory response during this phase. And nicotine use also lead, maybe the identified causes of this premenstrual dysphoric disorder. Next. So I'll take you through the case study of a woman who was diagnosed with the premenstrual dysphoric disorder. A woman who was a 24-year-old. As you can see, she is her occupation was software engineer. Presents with severe symptoms of whatever we have discussed. Just 1 week before her periods, and just after her period resumes, she will feel really okay, and she will be out of those all symptoms. And its impact is like on the work, her work productivity drops, and she has got some strained relationships uh, caused by PMDD. Physical symptoms also, she feels bloated, and she feels exhausted, she craves for sugary foods, and remarkably intense irritability was observed, and she picks fights over small things. Yeah. As we observed her mental status examination, uh, we have gone through all the areas which need to be done as formal mental status examination, through her appearance and behavior, speech, mood, affect, what is her cognition like, what's her thought content, what was the thought process she was going through, and how was her insight was like. Her mental status examination was done, and after you can just see that how the cognition of a woman who was affected with PMDD looks like. Yeah, next. So we will take you through a small role play where you can understand more clearly about PMDD. Yeah, we both, me and my teammate Preeti, will do a short role play. Yeah. Hello, Preeti.
Hello.
Yeah. Thank you for coming in today. Yeah. To start with, what has brought you here? What's happening recently?
Yeah. Every single month, for about 2 weeks before my period, my life just falls apart. I feel that. Okay. And then I become a different person. There is a lot of furiousness, terribly sadness, completely overwhelmed. I'm not able to understand.
Okay, I understand your feelings, whatever you have shared. Actually, thank you so much, Preeti, for sharing that so openly. And yeah, as you say, it seems like it sounds like a profound, challenging, and consistent pattern. As you're saying, every month you're telling that it's a pattern which you're experiencing. I want to understand more about these monthly changes. Uh, I mean, what feelings you experience when you come across this?
The shift is very quick. Okay, from one emotion to the other emotion, and profoundly, it is more of depression, overwhelming by anxiety.
Mhm.
So this is something which I have observed very frequently
Okay.
and constantly. Snapping, yes.
Yes, it sounds like really a disoriented experience for you. There's sudden changes which you're telling. Mm. How would you describe your general mood during that specific time
Mm.
just before your periods?
Um, it is utterly exhaustion is something which I can say. A lot of exhaustion and nothing brings a joy to me.
Mm. That must be incredibly heavy for you to carry each month.
Yes, yes.
Okay. So have you noticed any significant loss in interest in the activities which you normally enjoy?
I feel that it is completely disruptive.
Mm.
Complete, and I feel sometimes that my life stops.
I
That
feel.
is a phase I go through.
Mm. Yes, it sounds like these, it's truly holding your, uh, your work and your mood, even it's creating a significant challenges for you. I understand that. Um, so, Preeti, uh, what you have described these experiences which are overwhelming, uh, these are cyclical patterns of symptoms you experienced, right? And it sounds much more than premenstrual syndrome to me, and mm, that we will definitely do proper diagnosis for this. And Preeti, the good news is there are effective strategies and support systems that can help you regain that control and find relief. Okay, we will discuss them in detail in our upcoming sessions.
Okay.
Okay. As a crucial first step, I would like you to begin observing and journaling these patterns you notice every 2 weeks before your menstruation. You pay close attention to what seems to significantly worsening these symptoms, and note your triggers clearly each day uh, during that during that period phase. Mm.
लड़ने की बात नहीं है ये जो सही बात है वो है
Okay.
तो क्या करना पड़ेगा जी
So,
जैसे
when you
घूमते
start
तो
journaling
बहुत
this,
खराब
and
करेंगे
come
कभी कुछ
back
करेंगे
before
कभी कुछ
our
करेंगे कभी
second
वहां
session,
लगाओगे कभी वहां लगाओगे
Mm.
it
Can
will
someone
be,
mute them?
I know this will be very valuable for us for the correct therapeutic approach. We will find it in our next goals. So, see you in the next session, Preeti. Take
Sure.
care.
Thank you. Thank you so much.
So, moving on to our presentation. So, this is how the client experiences all these symptoms. So actually, we have to do the formal diagnosis. How is PMDD assessed is we use different scales like daily record of severity of problems. It's simply called as DRSP. It's like journaling, the daily record of these problems. And one more scale is CPAS, it's called as Carolina Premenstrual Assessment Scoring System. Even with this scale, uh, we can go diagnose the PMDD, and this is done at least for 2 consecutive months to confirm the link of the menstrual cycle. These scales need to be used for diagnosis, and what cannot be used for diagnosis is just relying on the memory and often memory is biased. Sometimes you may remember, you may not remember, and even one-time assessment without tracking also will not get into the formal diagnosis, and that we cannot go for diagnosis. And next, next would be the treatment and therapies we use for treating the women with premenstrual dysphoric disorder. The first and foremost would be the cognitive behavioral therapy, which helps identify the negative thought patterns, and we can develop coping strategies when these symptoms arise. And we can also go for dialectical behavior therapy, DBT. It is nothing but this therapy, DBT, it helps in teaching the crucial skills to the individual to manage intense emotions and behaviors during these flare-ups of the symptoms. And through these skills, the individual learn to respond more skillfully when during her pre-menstrual changes. And even the lifestyle and lifestyle modifications and self-care, taking proper diet, like reducing caffeine, reducing sugar, um, and regular exercises is also considered the best the treatments to treat PMDD. And one more important and helpful therapy for PMDD would be MRA technique. It is mindful based relaxation approach. It equips the woman with skills to better cope with these kind of intense emotional shifts and these physical fluctuations. And if the symptoms are really worsen, and we can go for medications, like we can use selective serotonin reuptake inhibitors, where our hormones will be adjusted. This is through in this medication approach, this is the first line approach, first line treatment for PMDD. And it can be taken with the consent of a psychiatrist. So these symptoms which the individual experience, it's not only like mood symptoms or behavioral symptoms. The impact is on I can say the impact of PMDD is multifaceted. It impacts different areas of the individual. Like I have visually created a diagram where you can see how would be the impact of PMDD look like on different uh, dimensions of like life, like behavioral, how PMDD is impacting our behavior, our emotions, physically, occupationally, even socially. So this you can just read like how the social impact look like. The individuals may get isolated. They will withdraw themselves. They will have strained relationships with their family, their friends, and they will have more conflicts. This is the impact of social. In the same way, you can observe the impact of PMDD on different areas. So, there is a self-soothing technique for PMDD. It's simply called as pat your five senses. So when you're experiencing these symptoms, high flare-ups of PMS, you can just use these five senses uh, exercise, like use your senses in if you can see that see when you see, you can just watch a short or a calming video clip of a nature, of any kind of your interest, to get into some kind of grounding. You can feel like use the feeling sense, like you can wrap yourself in soft or cozy blanket and eat whatever you like. But eat whatever you like means it should not trigger your senses. It should not trigger your symptoms. In like a sip of a warm herbal tea would help. This is a simple technique, but it really helps us to self-soothe. Next. So getting help for PMDD, I have created like when you experience these symptoms, where you might be thinking where to go for this kind of should I disclose these or not, these symptoms or not, will someone will validate my feelings or not, will someone listen to me or not. If you have these all kind of confusion, you can just visit a psychiatric department or a gynecologist or mental health clinics. And who can diagnose this PMDD is they definitely the trained doctors and trained therapist, clinical psychologist. And who cannot diagnose is very important. Like you cannot go to somewhere like untrained individuals, or take any online test which are not validated. So it's the step you cannot go for self treating. And there are professional self report questionnaires also. You can fill them and understand about your symptoms, but definitely you cannot interpret the results. You can take the help of the professional to interpret the results and get the right kind of therapy you need. Next. So as per World Health Organization, 3 to 8% of the women who are menstruating, they generally fall into this premenstrual dysphoric disorder. And you can see the prevalence in this slide. So to end with this topic, I would like all the participants to understand that, especially women, and the people whom you care about, understand that this menstrual cycle is a fundamental and natural rhythm of life. Yet, for those with the premenstrual dysphoric disorder, it can become a monthly battle against overwhelming symptoms that feel anything but natural. So, I would like to give a key takeaway from this discussion, understand that knowledge is our treasure. The more we understand about premenstrual dysphoric disorder, its nature, what is the impact, and how the management of this PMDD would look like, the more we understand about this disorder, the more we empower ourselves and around us also. So embrace this understanding and you gain clarity. The more we acknowledge and validate this experience, the more clearly we perceive its challenges also, and we unlock these paths to effective coping and support strategies. Resisting the truth about PMDD, it only prolongs the suffering, and that too the suffering in the silence. Okay, so let's break the cycle of this misunderstanding. It's time to bring more awareness about PMDD by speaking openly, sharing resources, and supporting research. we can transform this invisible struggle into a recognizable and treatable condition. So, together, we can create a future where no one suffers in silence with PMDD. So, and this is about premenstrual dysphoric disorder. Preeti, would you like to share something?
Yeah, that was very well said. That is one phase of the woman's life, right, Navya? Um, it is correct. The same way, the postpartum depression, by understanding the emotional and physical changes after childbirth, we can recognize early signs of postpartum depression too. So, dear participant, knowledge empowers a new mothers to seek help and embrace self care and heal with confidence. So, nothing that no, always there is someone to help you. Okay, it is something no which you have to come out of it if you are having that strong desire to come out of that. So, there are many hands which can help. But again, looking here is a person who is perfectly designated to that treatment to be done. So that's how you can definitely come out of these depressions. Yeah. Moving on. So here we have a question and answer session.
Yeah, Preeti, I'm there on phone. So
Yes, ma'am.
I am available for questions if anybody asks, and you're always there. Yeah, go ahead.
Yes. Um, dear participants, we are now open for the question session. You can pose your questions here in the chat box. Okay, here we have a question, ma'am. What about a lady with hysterectomy and suffering with? Will you suggest a doctor name in Hyderabad?
Okay, so see, there are many famous doctors, but in this open forum, I don't think we should suggest one single lady. But what I can suggest you is, when you are choosing a doctor, um, please look into her, credentials, that is education background and number of years of experience and success track record. And also the hospital where you are going should have all the facilities, because when something go, when you go, it should have multiple facilities. So that sort of hospital you should visit. This is what we can suggest, not a single name we can suggest here. Yes, Preeti.
Understood, ma'am. There is one more question here, ma'am. Does this PMDD occur at any age who is menstruating, even during premenopause?
Yes. It is not like it starts at some age. For some of them, it starts like initially in the early adulthood itself. But sometimes after they give birth to the children, also this starts. I have few clients who came after she gave birth to both the children, and they are at 10 to 12 years, and then she started this. Maybe one more thing, what I understand is it was there, may or sometimes we do not really, identify or acknowledge this, and at a point we acknowledge. Yeah.
Okay. Ma'am, why do they get disconnected from their babies? Do they think babies are responsible for their situation? This is about it is
Understood.
about postpartum depression, ma'am.
It's I'll tell you, in postpartum, what happens is the mother is not happy with the motherhood itself because of multiple reasons. Sometimes they need to stop the career. They need to take break, or sometimes there is no support from the family member. She need to bear. So that stress actually lead to that. It's not that they don't like the children. They like the children, but this all makes that feeling that I'm not able to bond. See, it's not like I don't love my child, but they say I'm not able to love my child. If you see, this difference will be there. They want to, but they cannot. That is a problem. Yeah.
True.
I think I'm able to answer.
Yes, ma'am, very much understood. The PMDD can be manageable with yoga and meditation is the question over here.
Yes, definitely yoga and meditation will definitely add. And we, as last webinar, I mentioned mindfulness and relaxation techniques, which are simple yet powerful, are available, and both can help. Both can help. And routine, good lifestyle, good healthy habits can also help you, along with awareness.
There is one question here, ma'am. Any other remedies help apart from what has been discussed during that session?
This is for PMDD.
I think it's a common question, ma'am.
See,
For both.
let me tell. For everything, for both, we cannot club both of them together. Both are different. So we can think about PMDD. For
Yes.
PMDD, the 6 pillars of health. I think Preeti, you can again maybe inform them about 6 pillars of health. That will definitely help.
Okay. Right. There is something called as 6 pillars, ma'am, that we will definitely share maybe in the group so that you will be able to understand it. So, ma'am, there is one more question. One who overcome postpartum disorder be normal in later age with their child and other emotions.
Can you repeat the question?
One who overcome postpartum disorder will be normal in later age with their child and other emotions.
Definitely. It's a condition, they will be back to their very, very normal. It may take few months also sometimes, and we have successfully helped many mothers, new mothers, to get back to their normal bonding with the child and normal life with full of joy and love.
So, ma'am says that is curable and you can see a normal person. So there is one more question. Do you think menstrual leave should be allowed in all firms and should be implemented?
Repeat the question.
Do you think menstrual leave should be allowed in all firms and it should be implemented?
It's not for every woman. It is not there. Number one, and every month, if you want the leave, I think that would be a problem. But see, it is not that taking leave from your routine do not become dysfunctional during this. I suggest personally, don't think in that lines that you become dysfunctional and you don't want to work. Please manage it. If you manage, you can definitely work and go through this challenge. It's not very tough. It is manageable.
There ends the questions, ma'am.
Okay, go ahead and
Thank you.
conclude. Thank you so
Thank you
much.
so much, Geetha, ma'am.
Congratulations, both sweet ladies. You have done the webinar wonderfully.
Thank you.
Wonderful.
Thank you, ma'am.
Thank you.
So, thank you all for your wonderful participation in the question and answer session. So here, as you know that no, Sudisha Counseling Center, I just wanted to brief you the services what we are providing at our counseling center. It's all about the IQ assessment, personality assessment and psychometry, ADHD assessment and support, behavior assessment for children, adolescents and youth, developmental assessment for children, learning disability assessment, special education and interventions for children with special needs, depressions, GAD, and OCD screening is also done at our centers. The center works from Monday to Thursday, and the timings are from 11 a.m. to 4 p.m. You can definitely consult to this contact numbers which are being provided over here. Okay, and this is the address at Pondapur. So please, if you require any of these services, you can definitely reach us. And then upcoming session, we have tomorrow session. It is all about the childhood disorders, which is a major challenge which we are seeing in every child, especially post-COVID. So this would be a wonderful session which will be taken forward by Shahin Nilofer and Nitya. So tomorrow we are looking for another productive session for the day. So thank you so much. Thank you all for joining us. Thank you, everyone.